Staying healthy can feel like one more chore on an endless to-do list. At ThedaCare, we make care simple and personal for you and your family. I'm Cassandra, and this is Help Inspire Talk. Each year, National Heart Month reminds us that cardiovascular disease remains the #1 killer of both men and women, claiming more lives than all types of cancer combined. The good news is that an estimated 90% of heart disease cases are preventable through adopting positive health habits. In today's episode, we'll hear the latest news around heart disease and share steps you can take to help improve your heart health. Heart disease has been in the news a lot in the past year. Dr. Malkawi, a cardiologist with ThedaCare, is joining us to talk about those headlines. Thanks for being with us.
Absolutely, thank you.
Okay, let's jump right in and take a look at the very first headline here. Research links melatonin to increased heart failure risk.
This study is what we call an observational study. They looked at databases in the UK and the US, and they were just thinking that there might be a link between long-term use of melatonin and heart failure. It does not really point to causation here. It might just point us towards the fact that people with lack of sleep, chronic lack of sleep, might just happen to have a high risk of heart failure, which is something we knew. So I would recommend if somebody has problems with insomnia and lack of sleep on the long run, that they seek professional help.
All right, our next headline here. Can mammograms detect heart disease?
Yeah, that's an interesting study too. Also came out as an abstract in the AHA guidelines. What they found is that there is a connection between the buildup of calcium on breast arteries and developing heart disease. And what's more interesting is that this was important, especially in people who otherwise we would perceive as low-risk people. They have lower cholesterol and low risk factors, but the fact that they have breast calcium on the mammogram is associated with having heart disease. And that brings us back to the importance in general of mammograms, not only for screening for breast cancer, but also just for detecting one of the problems is heart disease. And that's why we like to follow screening in general, because it helps us detect multiple problems in multiple systems.
Okay. Our next headline. This one is GLP-1 use could help prevent heart disease.
Yeah, so this is a great topic, and it's one of the hottest topics in cardiology over the last few years. GLP-1s are actually old medications, and they were originally created as regular diabetes medications. We just happen to find in multiple research studies that they are actually helpful for reducing heart problems, reducing stroke, and reducing kidney disease also.
Right.
Yeah.
Okay. Lots of impact there. All right, our next headline. American College of Cardiology recommends vaccination for adults with heart disease.
People with heart disease and heart problems are more vulnerable to get the infections, and if they do get an infection, they are more vulnerable than a normal person to have complications, just because their hearts are weaker than the average person. So any stress on that heart will create problems. So we like to avoid that with as much prevention as possible, and that's where this guidance came from.
Okay, and that's probably good recommendations for anybody to follow vaccine guidelines.
Absolutely, yeah. I think it's always good to just ask your primary care provider on the recommended vaccines for your group, for your category age.
Thanks so much for talking through these headlines with us. This is really great information.
Absolutely, thank you for having me.
When it comes to heart health, it's sometimes difficult to separate myth versus fact. Dr. Parvez, an electrophysiologist with ThedaCare, is joining us to set the record straight. Thank you for being with us.
My pleasure.
Okay, so we're going to take a look at some of these statements, see if they're myth versus fact, and then we're hoping you can explain them for us.
Of course.
Okay, our very first one here is heart disease can affect people of any age.
That is actually a fact. As we know, there are little kids which are born with heart disease, so it can start, as a matter of fact, right from even before birth. Congenital abnormalities, both of valve dysfunction, blood vessels which are not in their correct position, the chambers of the heart are not properly formed. Young people can have heart rate and blood pressure issues. And as we grow older, then we start having heart blockages and all sorts of other heart diseases.
Okay, so any age. All right, wearables such as smartwatches, things like that, they can detect problems with your heart.
That is an absolute fact. Nowadays, wearables of different manufacturers can detect irregular heart rhythms, fast heart rate, slow heart rate. They can even detect your blood pressure, your sleep pattern, your oxygen levels, also how much you are moving, all of which are linked with heart disease.
Oh, okay, good to know. All right, next one here. Women are more likely than men to have heart disease.
That is a myth. In men, heart disease starts earlier.
Okay.
Women have a buffer because of estrogen.
Right.
So women catch up after menopause, but men unfortunately have heart disease earlier, not only because of lack of that protective hormone, but also because of our inherent nature to be more prevalent to hypertension, stress. Men are also more likely to go to extremes on certain activities which are not very healthy, like smoking, alcohol intake, just sedentary lifestyle. So all of those things start compounding.
Good to know. All right, our next one here. U.S. cases of atrial fibrillation are projected to double to over 12 million by 2030.
That is correct, and it is a fact, and some of us project even more. AFib, unfortunately, it is predominantly an incurable condition. So the newer cases are becoming more and more because of prevalence of heart disease, the overall aging population. People are living longer because of advancements in medicine. And that is why, yes, cases of atrial fibrillation, heart disease in general, hypertension, diabetes, all of those are on the increase.
Okay. All right, Dr. Parvez, thanks so much for being with us and providing insight into all of these things.
Thank you, my pleasure.
And thank you for joining us today. Remember, our ThedaCare cardiovascular care team is here for you. Visit ThedaCare.org/cardiovascular to learn more. At ThedaCare, we're dedicated to inspiring each person to live their unique best life. And we want to hear what that means to you. Leave your questions and comments below and be sure to like and subscribe so you don't miss a thing.